Hi, I'm the clinical director here at Hudson Valley Mental Health. As part of our protocol, I just have to ask you a few questions just to screen you for your suicide risk. Is that okay?
Yes.
So, what had brought you here today?
I don't know.
You don't know? Did you come here voluntarily or did someone bring you here?
No, my dad brought me.
Okay. Now just gonna get into the questions. Can you rate your level of anxiety from a scale of 0 to 10, 0 being none, 10 being worse?
8.
8. And coping mechanisms, how do you cope with your anxiety?
Retreat. Stay by myself.
So you felt like you've been isolated and socially withdrawn recently?
Usually, yes.
Yep. And can you tell me your daily functioning, your level of daily functioning?
What do you mean?
Like, do you have energy to commit to do your ADLs and...
Yes, usually.
Usually? Okay. And do you use any drugs or alcohol to help cope with your anxiety?
No.
No? Good. And have you ever attempted suicide?
No.
And have you ever had a plan?
No.
Okay. And do you have adequate resources in your environment and your family to help you cope?
Sometimes.
Okay. Thank you. That's all that we have today.
Should I do it? I think I'm just gonna call.
Saskia, is that how you pronounce your name?
Yes.
Okay, Saskia, what brought you in today?
I was just walking across the bridge, and I just feel like if I just jumped off, maybe it would just end all the pain, all the misery, all the sadness, everything that I'm feeling.
Are you thinking about suicide now? Are you thinking about committing suicide?
No, not right now, not at this moment.
But you were before you came in today?
Yes, I was.
And what were you stressed about? What brought you to wanting to commit suicide?
Just stressed about dealing with everything, life.
Okay. What type of stresses that you have? Do you have a support system also?
I have a support system, but I don't want to burden anybody with my problems. It's my problems.
Do you live alone or do you live with family?
I live with my mom.
Well, Saskia, the type of services that we offer here at Hudson Valley Mental Health is something called outpatient therapy. And since you have considered suicide, you no longer are feeling that way, but we do feel that outpatient therapy would be beneficial to you. Is that something that you think you would be interested in?
Yes, I think I'll be interested in talking to somebody. Maybe it will help me.
Okay. Now that would consist of you coming here, okay, to speak with one of our clinicians every day. Okay, is that something that you could do?
Yes, I think I could be able to do that. It's going to help me.
Wonderful.
so stressed out. So many exams. I don't even know where to start. Maybe if I...
Amanda? Hi, my name is Allie. I'm going to be your nurse for today.
Where am I?
Right now you're in the hospital on the medical unit. Do you know why you're here?
No. No.
You're here because you took a lot of Xanax and Adderall together. Did you mean to do that?
No, I don't remember that.
So you're not feeling suicidal?
No. No,
Are you
I
having
wanna
any
go
feelings
home.
of trying to harm yourself?
No.
Okay, so right now, you don't seem to be suicidal, but you're on the medical unit. Now what's going to happen from here is that you go to...
When can I go home?
Well, once you're medically cleared, you'll be sent to the inpatient unit in the same hospital. And then based on your symptoms, the clinical team will decide where
There's nothing wrong with me. I want to go home.
Well, you're being held right now here, but when the clinical team comes in, the psychiatrist, they'll all collaborate and they'll decide whether or not you can go home. And then once you are cleared by the hospital, you can be in an outpatient ongoing treatment.
What's
So,
outpatient?
How that works is you will be able to go home, but you're going to have to come for therapy a few days a week, or depending on what they decide for you. And this is after they determine that you're not a harm to yourself or others. You'll be able to be home, but you'll come a few times a week and get treatment. And this should help you on an ongoing basis. Facilities such as Hudson Valley Mental Health, they provide this therapy to kind of get you back on your feet after something like this happens. It's ongoing treatment, and hopefully that will really help with your condition. Do you understand that?
Yeah,